Let's now look at the syllabus. Okay, this is the UPSC prescribed syllabus. Let's start with anatomy. I want to go very fast here because uh, we have 13 subjects in total. Okay, we have 13 subjects in total, and uh, these are first prof and second prof subjects because there's so many students from first MBBS, second MBBS who want to start their UPS preparation starting from the first MBBS, right? So if you want to ask me a question, what is the ideal time to begin our UPSC preparation, right? See, it depends. If you have guidance, if your parents are from UPSC background, or if you have any sibling from the similar background, you will be starting early. It also depends upon your mindset, right? And when you have decided to begin your UPSC preparation, there is no ideal time like when to begin your UPSC preparation. But most of 90% of the medical graduates, for them, the UPSC career is a U-turn. Like, because if you want to become a civil servant, you won't be choosing MBBS as a graduation subject to get into this UPSC, right? There are some easier ways wherein you can finish off your graduation within 3 years instead of instead of spending 5.5 years or 6 years in MBBS, then going to the same path, right? We are old aged people in comparison, right? So most of the students, they take a U-turn, right, during their medical career due to their personal reasons or anything related to the medical fraternity or what is happening with the medical world and all. So they take a U-turn, they start their preparation. And many of the students, they begin their preparation post-intern. So I see most of the students, almost 80% of the MBBS students, they start it in the post-intern phase. And now the trend is changing. There are various reasons for that. Let's not get into the general discussion, but people are starting their UPSC preparation during their third MBBS. So third MBBS is the ideal time to begin your optional preparation. So during third and fourth MBBS is the ideal time. Now, when you do that, it's okay. But the students who are starting it from first MBBS and second MBBS onwards, they might be having their own reasons. I don't want to discuss them here. But let me tell you, first MBBS and second MBBS are too early to focus on UPSC. Because if you're joining a medical college, you have to finish your internship to give your UPSC general studies exam or prelims exam or mains exam or optional exam or interview, right? You have a long 6 years of time. So during this phase, starting from first year till the end, you should be focusing on general aspects, what is happening around your world, and you should be focusing on your MBBS career, because at the end of the day, you have to qualify this, you have to get your pass certificate, you have to finish your internship, then you have to get into it. So definitely first MBBS and second MBBS are too early to begin your preparation. Third MBBS is the ideal stage. Now with this background knowledge, let's look at what are the first prof subjects. And if you are a first year student, if you're starting now, along with your regular syllabus study for the MBBS theory board exams, you have to focus mainly on the syllabus which is given in the UPSC. It's okay in your theory exams, in your board exams, if you don't draw any images, if you don't give any flow charts, or if you don't entertain any tabular forms or the conceptual stuff, it's okay, you will definitely pass. But with regards to UPSC preparation, they're focusing mainly on what kind of images you're drawing. Are you following algorithmic approach? Do you have current updated knowledge? So these are all things important from UPSC point of view. And you cannot get into so much depth with regards to first prof, second prof subjects during your MBBS, because you're just in a budding stage, you're just starting your preparation. It's tough for you to focus on all these aspects. Instead of focusing on whole books, right, focus on the syllabus and try to master these topics which are given in the syllabus if you're starting now in the first MBBS. So what topics do we have? So these are the topics which we could see. Okay, so the first thing is from anatomy point of view, they're not asking the whole of the anatomy. Let me give you a disclaimer. The syllabus is only 10% of what you generally read for your MBBS theory exams. It's only 10%. So within the 10%, they have made it so specific. Nowadays, questions are too specific from the syllabus. For example, I'll tell you, in the human anatomy, upper limb and lower limb are almost two different volumes from BD Chaurasia, right? But within upper limb and lower limb, they'll never ask you the osteology part. They'll never ask you the histology part. The upper limb and lower limb, they'll not ask you the embryology aspect. They'll not ask you the general anatomy, the relations and all. These are all out of scope. from upper limb and lower limb, they're asking you only applied anatomical aspects of the blood supply and the nerve supply. That's it. Blood supply and nerve supply of the upper limb and lower limb. And within that upper limb and lower limb, most important thing is joints: shoulder joint, hip joint, and knee joint. Shoulder joint. So either of the joint is asked in exam every year. If this year they're asking shoulder joint, you might expect a hip joint question or a knee joint question in the next year exam. So it is pretty clear. Applied anatomy, the syllabus they have clearly mentioned applied or clinical anatomy. So when you're preparing for anatomy, it is very important to focus on the clinical anatomy of the topic which you are reading. Even if in the exam, even if in the theory question, if they do not ask you the applied anatomy also, you have to mention 1 or 2 lines of clinical anatomy at the end. Let me tell you, I promise you that you are going to get extra half or 1 mark if you give that clinical touch to your anatomical answers. Even nowadays in PG exams also, the anatomy questions are integrated with general surgery, or they're integrated with OBG, so that you are having more or less clinical knowledge of anatomy rather than the rote learning all the gross anatomical aspects. So they'll not ask you gross anatomy from upper limb and lower limb. They'll not ask you histology, they'll not ask you the osteology, and they'll not ask you the embryology aspects of only joints, blood supply, and nerve supply. Blood supply and nerve supply. Blood supply mainly in the lower limb because we have varicose veins, the common condition, gangrene and all. Nerve supply mainly in the upper limb because we have most common injuries, that is brachial plexus injuries, right? So brachial plexus, varicose veins, gangrene. So when you're reading anatomy, it is very important to correlate with general surgery. So this integration is very important. You may not be writing all the surgical aspects in your paper 1, right? But again, for better understanding of anatomy, you also need to have that extra edge into general surgery. And this is integration. This is called vertical integration because you're linking first year subjects with final year. We also have horizontal integration, right? Within anatomy, physio, bio, it's very important that integration is a new norm in medical science. So during your first MBBS also, when you're integrating a lot of subjects, you have to focus on vertical integration and horizontal integration. This will also help you in plan B. Like if you want to pursue in future the PG part, PG aspect, you're still ready for that. So in that way, let me go very briskly into the anatomy. What is your first dictum from anatomy? Focus on the syllabus. Focus mainly on the previous year questions. That too, what is given in the syllabus. Not everything. If I give you upper limb, not everything from upper limb. Only the blood and nerve supply of upper limb. That too, the clinical anatomy. And fourth important thing is when they ask any question from anatomy, please mention. Please, it is very important to mention the clinical anatomical aspects, even if it is not asked. And fifth, very important, practice images. Images, because anatomy, even your question should contain a diagram. Whatever is the question, there should be a diagram in anatomy. This is very important. And even in the instructions given to you in the question paper, they're mentioning draw appropriate images wherever necessary. Use color pencils. These are the 2 statements which is given in your final paper. That itself says they're expecting you to draw images. If you're starting early, if you're just starting now, if you have a lot of time, it's always a good advice to start practicing some of the basic images. So you won't be doing a lot of images. You will be doing only the basic images. Okay, right? So you don't need to worry about how many images you're practicing, and don't be scared of the image practice. Initially, it looks tough, but later on, it goes very easy and smooth, and they don't need artists there. You don't need to be a pro in drawing images. You have to be like the examiner should get a brief idea of what is happening, right? So that is very important. Yes, Manoj. Using color pencil and managing time, both possible? Yes. Recently, I did conduct an interview with Dr. Rakshita, the 2020 medical science optional topper. She scored 299. I asked her what is her secret for success. Her clear statement was this: she was doing flowcharts, she was drawing a lot of images, and she was using color pencils. And again, can you manage both? For example, you won't be drawing images for each and every question because there are clinical questions and all, but when there is a necessity of the image, better time management comes only with the practice. So here comes importance of test series, answer writing practice. When you do that, when you practice your images, then you can draw them very fast. And when you're giving an image, you are compensating that time by giving less text. Instead of giving a lot of paragraphs, you can just draw an image, you can properly label it. That itself is an answer for you. Okay, that is the beauty of medical science as an optional. A good image, a good table, a good flow chart will suffice, will give you more marks than giving a paragraph approach, right? So that is very important. So you can better manage time and you can use color pencil. That's not a dictate, but it is advised by the board. It is advised by the board. Now, next thing is, let's come back to the syllabus part again. So anatomy, 5 important aspects I already told you. Now, what are the other topics do we have? Upper limb, lower limb. Then let's get to thorax and abdomen. Okay, thorax and abdomen, and also head and neck. In the head and neck aspect, they're asking you gross anatomy. Now you have to focus on the structure, the size, the shape, the relations, and also the blood supply, lymphatic drainage of tongue, thyroid, mammary gland, stomach, liver, prostate, and the testis and ovary, and the uterus. So they might ask you gross anatomy, blood supply, lymphatic drainage. That's it. Next, applied anatomy. Here they're not asking you what are the relations of the diaphragm or perineum or inguinal region. It is applied anatomy. For example, you got so many questions recent aspects of inguinal region, that is direct hernia, indirect inguinal hernia, right? So you have to focus only on the clinical aspects here. Now the same clinical or applied is same. There's not much difference. How you are applying this knowledge in the clinics is applied anatomy. What are the diseases you get out of kidney, urinary bladder, uretary tubes, vast differences? Clinical anatomy. So this is human anatomy as a whole, but there's a special focus on embryology. There is special focus on embryology. I'll also give you the books which I usually refer here itself so that it is easy. From anatomy point of view, for understanding anatomy, we refer the Gray's Anatomy, but for UPSC, you don't need to read Gray's Anatomy at all. BD Chaurasia is the most standard book, but IB Singh is very good for embryology. And again, reading some aspects of clinical anatomy for Bailey and Love, because when you open BD Chaurasia and look at the clinical anatomy point, they'll just give you the headings, like what is this malrotation of gut, right? What is EBS? They give it in a shorter form. But when you go and refer the same in Maheshwari Orthopedics about EBS palsy, Klumpke's palsy, what happens with brachial plexus injury, what are all the tests we usually do it for it. If you can expand your knowledge, I think you're going to get 1 extra mark. But again, don't strive so much for 1 extra mark. Basic study is very important. You are here to get 300 out of 500, not 500 out of 500. Okay, this is only for people who have a lot of time, who want to excel in medical sciences as an optional, and who want to use medical science as their strength. So for them, you can just expand your knowledge clinical anatomy by looking into Maheshwari and also Bailey and Love for the clinical anatomy aspects of whatever topics which are given in the syllabus. Now, embryology, IB Singh, more or less, it will work for you. There's so many, for images also are good in IB Singh. Now, placenta, placental barrier, development of heart, development of the gut, kidney, uterus, ovary, testis. So when you're reading anatomy, you need to focus specially on their congenital abnormalities. Okay, you have to focus specially on the congenital abnormalities aspect. Now, they also gave in the syllabus the Neuro Anatomy. Neuro Anatomy, Vishram Singh's Neuro Anatomy will definitely work for you. Even in BD Chaurasia also, in the volume 3, the head and neck and brain, interesting aspects from the brain and spinal cord are already given. But the whole neuro anatomy is not important for us. You have to focus on the central and the peripheral. In the central, the brain. So within the brain, you don't need to know about the gross anatomy of the brain. Cerebellum, ventricles of the brain, how CSF circulates, what are the CSF findings you see with disorders, the clinical aspect, what are the neural pathways, the ascending pyramidal system and extrapyramidal system, and dorsal lemniscal pathway, the cutaneous sensation pathway, optic pathway, auditory pathway, and very importantly, these days they are asking so many questions on the cranial nerve distribution, functional components of the cranial nerves, right? General visual afferent, general visual afferent, special somatic afferent. So they're asking the functional aspects, the functional components of the cranial nerves. You have to focus on that, and special focus on autonomic nervous system. Be it be sympathetic, be it be parasympathetic. What are the parasympathetic ganglia you see? What is their anatomy? What are the sympathetic ganglia you see? Their anatomy. That's it. This is the anatomy syllabus. Beyond this, you don't need to refer for osteology is out. Recently, there was one question from a student asking, what about histology? Histology, you don't need to prepare for anatomy point of view, but understanding the basic histology of important organs, when you understand them, that background knowledge will help you in drawing histopathological examination images in pathology, and also understanding diseases which are seen in pathology. Because when I say pathology, when you write an answer for pathology, it should contain HPE image. It's well and good if you use HB pencils. You have hematoxylin and eosin pencils, right? But again, you can even use color pencils, or even in black pen or black pencils, you can definitely do that. But time management is always an issue. You have to practice that. But HPE images, histopathological images, are dictum for pathology. Let's come back here. So how anatomy and pathology are linked? If you want to learn general histology of major organs, for example, if you know histology of lung, you will better understand what is happening in lung cancer, the pathology aspect, what is happening in small cell carcinoma, what is happening in non-small cell carcinoma. You can draw those images, right? You can draw those images if you have a basic understanding of normal histology. Just for that understanding sake, focus on histology. But beyond that, you don't need to stretch any extra miles for understanding histology. But embryology is very important. Clinical aspects are very important in anatomy, and these days, each year in question number 1, they're asking one bouncer question from anatomy. I don't know why they're asking is because 99.99% they stay within the limits of the syllabus. Okay, let me tell you, if it is a bouncer, it is bouncer for everyone. It's not only for you. And just for the sake of rarity, you can't just prepare rare questions and go for this exam. You have to prepare in a smarter fashion for these kind of exams, right? Hope you're getting my point. So don't worry about bouncers. Don't worry about out of syllabus questions. A rare question is rare for everyone. That's never a deciding factor. So in search of rarity, never ever ignore or neglect the common questions, right? So this is very important. So this is anatomy syllabus. What are the books again? Gray's Anatomy. Don't go for it if you don't understand concepts. It's okay, but mainly BD Chaurasia will work for you. But for clinical aspects, Maheshwari, Bailey and Love will definitely help you for clinical aspects, and IB Singh for embryology, right? So this is anatomy. Let's quickly jump to the physiology. Physiology is that subject wherein it's pretty simple, not in a way to understand, but physiology is simple in such a way that there's no bouncer or rare questions. You can predict the questions from physiology. If they ask synapse or nerve muscle physiology now, they'll ask skeletal muscle question next year. But when you're preparing physiology, what is the book that you prefer? Because there are SRB book is there for physiology. Shambulingam is there for physiology. Gannon is the standard book which I refer for preparing content. You also have Guyton, which is like not required for this kind of exam. So what book I usually refer for physiology is Gannon. Even Shambulingam works because this is an answer writing exam, right? Understanding concepts, Gannon will help you, because when I teach or when I give you notes, I need a better conceptual understanding. But when you're preparing for an exam, any physiology textbook which gives you key concepts will work. What is the beauty of physiology? It stays. There's no new things which are coming up here. It's as factual as it is, but it is conceptual. Okay, maybe new concepts will come, but it is pretty factual. You don't need to draw any images here. Mainly, there are some areas wherein you can draw images, but more importantly, you have to be focusing main on the conceptual aspects of physiology, and there's no surprises or bounces in the subject of physiology. And the syllabus is divided into nerve muscle physiology, wherein you will be looking at impulse, contractions, neuromuscular junction, the reflexes, monosynaptic and polysynaptic reflexes, how equilibrium, posture, and muscle tone is controlled. Just focus on this word: control of equilibrium, posture, and muscle tone. What is the role of cerebellum, cerebral hemispheres, basal ganglia in this regard? This area is very important zone for discussion nowadays. Control of equilibrium, posture, and muscle tone. It's gaining a lot of importance these days. There's so many questions in the recent past on this subject: cerebellum, basal ganglia, cerebrum, how they help in controlling it, what happens in Parkinson's disease. So this area, you have to master it for this particular exam. Again, neurophysiology is related to neuroanatomy. Even when I teach for combo course, what I do is I mix most of the anatomical aspects in neuro with physiological aspects, because descending pathways, ascending pathways, pyramidal system, extrapyramidal system, what happens if there is a problem, anatomy of the cerebellum linking to the functions of the cerebellum, basal ganglia anatomy linking to what happens in Parkinson's disease, right? So these three aspects are linked. This is called as horizontal integration. So when you're preparing neuroanatomy, also focus on the neurophysiological aspects, and in the neurophysiology, descending pathways is given in physiology. Descending pathways. Lesions of the cutaneous sensation is given in anatomy. So they're focusing more on how they're organized. Here they're focusing more on what is the physiology, how pyramidal system works, how extrapyramidal system works. So this is what is asking in neurophysiology. So you can club them together to avoid confusion and prepare it as a whole. Neuroanatomy plus neurophysiology. Now here the next important topic, for example, as I told you, control of equilibrium, posture and muscle tone is a dictum topic. Similarly, physiology of sleep is very important. Sleep physiology we did discuss in greater detail in our videos, and I gave you very good notes for that. So sleep physiology is also an important dictum topic from physiology point of view. The next is endocrine physiology. So what happens here in endocrine physiology? Not many questions are asked, but again, pituitary gland is the common question, and also from pancreas, exocrine function of the pancreas, and we have endocrine pancreatic functions. So that is a major area they ask. Now, when we read about pancreas, you can integrate it with the pharmacology again, vertical integration, because in pharmacology, diabetes, okay, hypoglycemia, what are the manifestations? So they're asking this question here in physiology. What are the clinical manifestations of hypoglycemia? This is actually hypoglycemia, clinical manifestations. It's look like more of medicine and pharma related to insulin, but again, they're asking in physiology. So this is how they're vertically integrating it. So in the syllabus, even when they integrate, let me tell you, this is not a bouncer or a rare question. They're only asking questions from different subject, that too which is given in the syllabus. So you will be learning pancreas in 3 areas. Pancreas, you will be learning the physiology of pancreas is there. Anatomy, they're not asking. But when it comes to the pathology and also the general surgery, we have a topic called pancreatic carcinoma, which is very important again. Pancreas of the head of CA, head of the pancreas, is there in the syllabus in surgery. And when it comes to pharmacology pancreas, what is that they're asking? It is very important. They're asking about the insulin and how anti-diabetic drugs work. This is how you can link it to the pharmacology. You have to do this. You have to vertically integrate it while reading. That's what we do when we discuss in our video course. We vertically or horizontally integrate so that you have a holistic understanding of the topics which are given in syllabus across the focus guide. Many of the students are getting confused, sir, why we are discussing this. Like when I'm teaching you physiology, why I'm discussing the pharma or the general surgery aspect? The reason is this is somewhere given in the syllabus in either in paper 2 or other sections. Okay, hope you're getting this part. Now let's quickly jump into the last 2 aspects. Cardiovascular physiology, dictum topic is cardiac output. Regulation of BP is also asked, and also hematopoietic system, monophyletic theory of hematopoiesis, what is thrombopoiesis, disorders, coagulation disorders, which is there in the medicine, is linked to the development, regulation and fate of blood cells here. So hematology comes in 2 ways. Here in this physiology and also in the medicine, they gave a topic as coagulation disorder. So you have to focus on both. Now, reproductive system, what is menstrual cycle, what happens in pregnancy, and very important is lactation, lactational reflex, how oxytocin helps in this, right? So what happens during lactation, and also you can link this lactation topics to the breastfeeding of pediatrics, very important. Baby friendly hospital initiative from pediatrics is there in the syllabus. So there they'll ask you what is the technique of breastfeeding, what is the ideal way of giving breast milk, so what are the advantages of breast milk. These are all the questions which are there in the pediatrics aspect, but you will be learning the physiology of the lactation here, physiology of the lactation. That's it. This is the physiology syllabus. What is physiology? Nerve muscle physiology, neurophysiology, endocrine physiology, reproductive system, and cardiovascular. And neurophysiology, actually during my preparation, during my MBBS, physiology, when I think of physiology, the scarier part is neurophysiology, but they're only asking 4 topics here: descending pathways, cerebellum, basal ganglia, physiology of sleep. So syllabus is too limited. You have to focus on these topics, but learn them in an integrated fashion, right? And what books do I prefer? I prefer Gannon for this, okay, not less or not more than that, because I also make PG content. I find it very easy, but you can go for some basic books, which in a key concept manner, they'll give a lot of stuff in Shambhalingam. You can go for that also. Physiology. Now, biochemistry is scoring subject. Biochemistry, very important. The weightage is almost 1/3 in comparison anatomy, physio, bio. Within bio, they only have 4 major headings. One is organ function test, thyroid, kidney, liver. If this year they're asking you, not this year, every year they're asking the same question about jaundice, liver function test. How will you differentiate pre-hepatic, hepatic, and post-hepatic jaundice? They can go for kidney, the serum creatinine estimation and all. They can go for thyroid function tests also in the future. So only 3 organ function tests, very vital. Now, when you read this organ function test, the content which is given in U. Satyanarayana, the biochemistry standard or basic book which we use, no need to go for Harper's Biochemistry for biochemistry. Harper's Biochemistry will definitely help you in understanding tools in biochemistry in detail. Restriction, fragment length, polymorphism, PCR, radioimmunoassay and all. You'll understand them better in Western culture, Western literature. But basic things like how proteins are synthesized, how vitamins, what is the biochemical function, what is the biochemical reactions, how minerals function and all, what are the organ function tests, the basic knowledge you can get from U. Satyanarayana. But I also refer Harrison for vitamins, because in Harrison, the vitamin deficiencies are very neatly given, because they're asking what are the deficiency manifestations of vitamin C. If you open biochemistry U. Satyanarayana, you will get only 3 or 4 headings. But if you want to learn in greater detail, I'm finding more details in Harrison. Similarly, the biochemical reactions of the vitamins are better given there than in the general biochemistry part. And organ function tests also, when you read approach to a case of jaundice, approach to a disease is better given in Harrison than the U. Satyanarayana. So use U. Satyanarayana as a basic thing. When you get into the medicine part of the preparation, there you can focus more on the approach aspects, the organ function test aspects, the vitamin deficiency manifestation. And for tools of biochemistry, the better book is Harper's Biochemistry, because they deal in such a greater detail there, right? Vasudevan, I don't have direct experience with Vasudevan. I'll look at that book and I'll tell you. Basic book is okay. Any U. Satyanarayana or Vasudevan is okay. But standard books, you only refer them just to master them or gain concepts. Let me give you a disclaimer. Basic books will work for you. Basic books worked for our last year topper. Okay, Akshita. She scored 299 by just looking at the basic books. I'm quoting you what books I usually refer to give you standard literature, because there's a lot of competition nowadays. It's mounting up unless and until you have better knowledge, current updated knowledge. Because Western literature, we get more frequent updates and more latest content is given there instead of our Indian author literature, right? Anyway, they grasp information from the Western literature itself, because research is not that much great in India. So in that aspect, going to Western literature, if you have time, will fetch you good marks. But again, basic books also work for you, right? So again, I don't want to get into this book discussion, name discussion part. Even for my PG preparation with my PG students also, the same debate always continues, right? So which book is better? The book which you are comfortable with, the book which you're getting more answers, the book which contains easy content, conceptual content with easy images. You can draw them easily, right? For example, Harsha Mohan, you can draw histopathological images by looking at Harsha Mohan. But Robbins, you cannot depict the same histopathological slide in your exam, right? So in such sense, Harsha Mohan work for you. But content-wise, standard literature, gold standard is always Robbins. So it's always important to have 2 or 3 books in hand, but it is always important to have in mind that idea or knowledge, what topic to be referred in what textbook. I think that is the knowledge I am giving you through this session in understanding syllabus part, right? So some aspects, biochemistry, U. Satyanarayana, 95%, 5% Harper's Biochemistry, and the additional information, just to make your answers more interesting for the examiner, you have to refer Harrison for the vitamins mineral part, and also the organ function test, approach to kidney disease, approach to thyroid disease, that is jaundice, that is the liver, and also approach to a patient with thyroid, because in the thyroid, the syllabus manifestations, I'll tell you, vertical integration, hypothyroidism, hyperthyroidism is there in the syllabus in medicine, right? So they'll definitely link it to that. Even in kidney also, we have kidney tumor diseases. Tumors of the kidney is asked and pyelonephritis is asked, kidney stones is asked. So in such way it is related. Liver also, it comes in parts, bits and pieces in each of the clinical subject. So that way understanding organ function in detail will form a basement so that you can better integrate clinically at the later point of time. I think we took a lot of time. I didn't think that it's going to take so much time for finishing of paper 1 section A, but I think apart from the syllabus, I also gave you many of the dictums, what should be done and what not should be done, right? So anatomy, physiology, biochemistry, look at biochemistry, simple, right? It's a scoring subject. In paper A, section 1, biochemistry is the scoring subject. Now pathology. Pathology, the books again, Robbins and Harshaman, as I already told you, right? So what are the topics they gave here? They gave the following topics here. One is inflammation and repair. Inflammation and repair. In the inflammation, you have acute inflammation, chronic inflammation, and granulomatous inflammation, and mediators of inflammation. All these questions were asked. In the repair, you have tissue repair and wound healing. What are the extra ECM elements which help in tissue repair? So this is the only syllabus, like inflammation and repair. Then we have neoplasia, chapter 7 in Robbins. You have to differentiate benign from malignant tumor. You have to differentiate a primary tumor from metastatic. Because these days, recently, I have seen questions on tumor markers. I have seen questions on what is the lab diagnosis of cancer, what are all the tests we use. This is the recent question. So within the neoplasia, the crossing the boundary. If you have time, deal the topic of neoplasia from Robbins in detail if you want to do. But if you want to do a basic study, as I already told you, just to get 300, I think it's okay differentiating these things. Now, pathogenesis and histopathology of bronchogenic lung carcinoma, CA breast, because CA breast also comes in general surgery. Oral cancer also comes in general surgery. You can integrate them. Cancer cervix also comes in gynecology. You can integrate there. And leukemias also comes in general medicine. You can integrate that. So learn the pathogenesis, histopathology here, because you will be learning etiology, clinical features, investigations, management of these cancers in various clinical part of the paper 2, section A or section B. Now, ischemic heart disease is very important. There's so many questions, but rheumatic heart disease is losing importance nowadays. Even in India, the cases like rheumatic way of getting heart valvular diseases has been come down. We are using penicillin prophylaxis, right? So with this, previously 10 years back, 15 years back, there's so many questions on rheumatic heart disease, but now it's losing importance. So better not to focus on that, but focus more on ischemic heart disease. Similarly, we have cirrhosis of liver, glomerulonephritis. See, this topic is very important, even for medical PG point of view also. Glomerulonephritis, we have nephritic syndrome, nephrotic syndrome. In the nephritic, we have post-streptococcal glomerulonephritis, which is commonly asked. In the nephrotic, we have minimal change disease. We have membranous glomerulopathy. We have focal segmental glomerulonephropathy. We also have rapidly proliferating glomerulonephritis. So all these aspects should be covered both clinically, that is etiology, pathogenesis, clinical manifestations, histopathology, management of glomerulonephritis there in the syllabus. Only histopathology, pathogenesis is asked in the pathology. The main details are asked. It is a part of the syllabus in medicine. So you have to focus in a holistic approach. That's what we do. And next is tuberculosis. Tuberculosis, look here, they're asking etiopathogenesis, histopathology of TB here. The same TB is asked in PSM as RNTCP, which is now National TB Elimination Program. The same TB, the management aspects in pharmacology, anti-tuberculous drugs. So you have to link them together, 3 of these things together, and read tuberculosis. Then we have acute osteomyelitis. Acute osteomyelitis is etiopathogenesis, histopathology. Please don't read the management of acute osteomyelitis, because in the orthopedic syllabus, we only have 3 topics. One is bone tumors, the other is fracture of the spine, and other is Colles fracture. That's it. Fractures of spine, bone tumors, Colles fracture. One indirect is histopathology, etiology, and pathogenesis of acute osteomyelitis. Not treatment. Don't get into the details of managing acute mastitis, because it's not in the syllabus. And this year we got a surprise from orthopedics, because orthopedics is long gone. From 2014, there's not even a single question from orthopedics. Even in my first and second strategic videos and workshops, I told students not to get into the details. But this year I have included all the ortho topics in the notes, because they asked Colles fracture in last year, right? And there was one question on fractures of spine previously. So we might expect bone tumor question this year. Maybe for the future next year students, please focus on bone tumors because that is an expected question. So slowly ortho is into the picture, but acute osteomyelitis is from pathology, not ortho. Don't get confused. Okay. So this in-depth syllabus understanding is very important, because otherwise you will not find it easy. When you look at a question, you think that it is out of syllabus. Nothing is out of the syllabus. It only comes with understanding syllabus properly. We're done with the pathology. See how simple the syllabus is. Inflammation repair, neoplasia, some carcinomas, histopathology, and some 4 or 5 diseases, histopathology, pathogens. So that's it. But look at the volume of the Robins. So when you say pathology, don't think that for medical science optional, you're going to read whole of the pathology. Not even 100 papers of the Robins you're going to read. Just 50 papers you're going to read here. That's it. Now microbiology, dead easy scoring. But problem with microbiology is there's a lot of integration happening with microbiology. Microbiology, infectious diseases, arthropod-borne diseases from PSM, the national health programs from the diseases itself, and even in medicine, infectious diseases, rabies is separately given, right? They're asking questions on rabies, the management aspects, clinical presentation aspect of rabies. The same rabies comes in National Rabies Control Program again in PSM part. And typhoid, you have salmonella as a bacteria, and you have management of the typhoid there, and drugs related to the typhoid management. Everything is integrated. So when you're reading microbiology, I want you to read the same organism from textbooks like this. So let's come to the textbook part of microbiology. For microbiology, Anantanarayana is the textbook, and Panikkar for parasitology works fine. But the problem is, I'll tell you, questions are more clinical these days. They're giving you a clinical scenario. They're not directly asking what is the lab diagnosis of salmonella, because lab diagnosis and the diseases caused by. These are the only 2 aspects that should be asked from microbiology. But instead of diseases caused by, they're asking pathogenesis. So whenever you're giving pathogenesis of any of the organism, you have to conclude it with clinical features, because that is what they're asking. For example, what are the diseases caused by Aspergillus? Aspergillus causes sinus, Aspergillus causes ocular infection, ear infection, right? So you have to mention all those things, but how it causes also you have to read. So even it is not given in the syllabus, the pathogenesis of these diseases, the diseases caused by, clinical manifestation, and lab diagnosis means laboratory diagnosis is different from investigations. I see many of the students giving general basic investigations. See, when I say lab diagnosis for Shigella, as a microbiologist, when question is asked from microbiology, I think I am expecting question as a part of biochemical. I'll be more happy to see biochemical reactions. Instead of you giving me something else, some serological also fine, because serological diagnosis is again microbiology, but radiological investigation. So don't ever give radiological or endoscopy or colonoscopy. You can just mention them as other tests. But at the end of the day, what is more important is in the lab diagnosis, you have to give serological diagnosis. You have to give culture media. You have to mention transport media. You have to mention what are the samples which are used. You have to mention what biochemical reactions you usually see. At the end, little you can mention other tests. But problem here is, I'll tell you, if you see a question from dengue, it's very tough to differentiate whether this question is from microbiology or whether this question is from PSM, because dengue control program is National Vector-Borne Disease Control Program, or you can, dengue is also in the pediatrics and general medicine. So you don't know how to answer that question and what investigations to write. So there are some topics which are discussed in an integrated manner in our video course. So therein we'll be covering all these topics in an integrated manner, starting from the micro part, infectious diseases part from general medicine, PSM part. Very important. And also there is a ramification again from pharmacology. There are some antibacterial drugs, antiviral drugs, antiparasitic medications, antifungal therapy. All these are part of pharmacology again. So you have to club them together as a whole, all the 4 subjects to be learned together. That's the beauty of microbiology. Though there are only 9 microorganisms, you have to do both vertical and horizontal integration, so that you're covering almost 4 subjects. Major chunk of the paper is infectious diseases, right? So as a physician, as a general medicine doctor, I know the importance of infectious diseases. Okay, they call me a fever doctor, right? So infection is day in and day out for me. The more you integrate, the better you understand microbiology. And again, not all the things, only 3 bacteria, 3 viruses. Dengue is not given here. Dengue is given in the general medicine part. Only 3 parasites: malaria, Entamoeba histolytica, giardia. For the parasitology, I usually refer Paniker's parasitology. Okay, so this is what is microbiology. There are some aspects in microbiology separate immunology. Now we deal in our video course, we have a separate entity called immunology, because immunology comes in both the topics, both the subjects. It comes in some parts in microbiology, some parts in pathology. But more importantly, in the syllabus, they only give you humoral and cell-mediated immunity. So this is from pathology, actually. Pathology. From pathology, from Robbins, and also from Satyanarayana, you can take some important points, like what are antigens, what are the type of antibodies. All these are better given in the Satyanarayana. What is humoral and cell-mediated immunity? The mechanism, the flow charts, the diagrams and all are beautifully given in the Robbins part. So even in the microimmuno part, humoral and cell-mediated immunity, you have to refer both the books. And also important thing to note here is the not many questions in immunology, 5 or 10 marks of questions are asking. As a surprise, they ask what is monoclonal antibodies, what is interferon therapy, where they are used. So these kind of questions they are asking. So immunology as a whole, we have around 10 to 12 hours of discussion on immunology, the complete immunology. This is very important because they're asking out of the boundary questions for this. So that's it. From humoral and cell-mediated immunity, what are the elements, what lymphocytes we use? For example, in 2021 paper, they asked about the subsets of lymphocytes. Just add a note on them. Subsets of lymphocytes. This is the only question from immunology in 2021 paper. So you have to focus on what are the cells of the immune system, how humoral system works, how cell-mediated immunity works. What are the, when I say humoral immunity, what are the antibodies? What type of antibodies? What is IgA, IgD, IgE? What is this Gels and Coombs classification? Just focus on those aspects. So this is microbiology. This is how you can understand the syllabus. Yeah, Sparsh Gupta is fine. Harsha Mohan is fine. Apurva Shastri and all, PG books is okay, but PG books, the problem is when you read PG books, I'll cover these points in UPSC prep versus PG prep. In PG books, the problem I'll tell you, the problem here is they give it in so concise manner. They'll not put images there. They'll not give you tables and flowcharts. They'll give you most common. This was the question. This was asked in 2021. Most common. This was the question. This is the underline. So when you read PG books, you will be gaining crisp knowledge, but you can't retain for theory answer writing. When you want to do it for UPSC prep, do it like a theory preparation. You have to refer either the literature which we give, the UPSC MEDICO notes, or the standard textbooks. You have to see the content as a whole, right? So again, you're asking, you're quoting lot many books which I didn't even refer, but okay, if you find valid content in CP Babaja also, you can go for it. Okay, but only thing is that book you should be able to find answers for all the previous year questions in that book. It should be easy for you to understand, and the images which you see there are, you can easily draw them, or you can easily memorize or revise or retain them, right? So that's very important. Let's quickly jump to pharmacology. We read 50 to 55 classifications in MBBS, the pharmacological classification. But when you read here, the most important thing is you are reading only 10 to 15 classifications. That too, only 5 or 6 classifications are important. That is the reason when there is any question from pharmacology which is asked in 15 to 20 marks, please make sure that you're giving perfect classification. That will give you good marks. So take a day off or a half a day off. Just look at all the drug classifications, memorize them by heart. This is very important. Antipyretics, analgesics, NSAID classification, opioid classification. Within the antibiotics, this is very huge, antibiotics. But they never, ever so far, except from the first topic, that is penicillins and cephalosporins. Cephalosporins also just this year they are asked about cephalosporins. Penicillins, cephalosporins, beta-lactam antibiotics. They're only asking questions from beta-lactam antibiotics. They have never been to macrolide. They have never been to the polypeptide antibiotic. They have never been to the other aminoglycoside antibiotics so far. Maybe in the future we might expect, but as an optimist, just to save my time as an aspirant, I'll be reading only the beta-lactam antibiotics, not everything. They clearly gave you in the syllabus. You have to read classification because sometimes they're asking classify antimalarials. Mechanism of action, very important. When you're giving mechanism of action in the exam, always give flowcharts or images. Side effect profile, right? Side effect profile, I had seen many of the answers when I correct papers and all for test series. You're just quoting them. See, what is the common side effect we usually mention? GI intolerance, nausea, vomiting, abdominal pain. Only you're quoting only this. When I say side effect, for each of the drug in the syllabus, mainly the generic drugs, most important drugs. When I say antidiabetic, metformin. When I say antifungal, ketoconazole. The first thing, the first drug that comes into your mind, at least for that drug, you have to memorize characteristic side effect. Characteristic. Penicillin, Zaris Herxheimer reaction. When you quote that, examiner feel happy. Cyclophosphamide, hemorrhagic cystitis. So you have to memorize characteristic side effects of the drugs. And also, side effect of the drug, they're asking for 5 marks. Just mentioning a drug will not work you, right? So if you only mention side effect of cyclophosphamide is tumors in the future because immunosuppression, secondary infections are there, and also hemorrhagic cystitis. Elaborate on characteristic side effects. Why hemorrhagic cystitis? Why do we use Mesna in hemorrhagic cystitis? What is the role of acrolein in causing hemorrhagic cystitis? So these aspects we do discuss in the videos. This is very important. You have to mention all those things just to make sure that you are answering to the weightage of the question. You cannot just enlist and expect full marks. You have to give better details. So side effect profile is very important. Though in the syllabus they are giving mechanism of action and side effects, there are 3 more areas which you should be focusing on. One is classification, other is side effect profile with details, the other is therapeutic uses. And in the last 5 years, one more component added. What is that one more component? Within the pharmacology, classification, mechanism of action, therapeutic uses, side effects, and drug interactions. So explain why is the latest trend here. Explain why. This is what they're asking. Explain why this drug A should not be given with drug B. So drug interactions, please make a note. For all the syllabus, drug interaction is vital. And very recently there was a surprise that instead of asking ketoconazole, they're asking fluconazole. All these days I was very happy. I was only teaching the basic drug, the first drug. But very rarely, not this year, the 2020 paper has 2 questions. Instead of asking chloroquine, they asked mefloquine. Instead of asking fluconazole, ketoconazole, they're asking fluconazole. They're just going to that next level. Why do we get new drugs? Just to combat the side effects caused by the old drugs. Even if you're not aware of that new drug, you can mention all the mechanism of action, side effects, profile of that basic generic drug. The knowledge which you have, you can put it in the paper. Just for 1 or 2 misnomers or bouncers, I think it's not easy for you to prepare all the secondary or tertiary classifications, right? So I'm keeping it simple here. So in pharmacology, classification, mechanism of action, therapeutic uses, side effects, drug interactions are very important. Very important, right? So antipyretics, antibiotics, antimalarials, anti-Kala Azar. Kala Azar is there in the general medicine again. Okay, malaria is there in the microbiology. Anti-diabetics, they very important. Complications of the diabetes and its management is there in the the pathology part. And we have general and cardiac vasodilators, antivirals, antiparasitic, antifungal, immunosuppressant, and anti-cancer agents. These are the drugs which are asked in the syllabus. Only these drugs. Next is forensic medicine and toxicology. 2 books ready. And also Biswas, Gautam Biswas, Principles of Forensic Medicine and Toxicology. Toxicology, the toxins part, I prefer Harrison because management is better depicted there. The snake bite management, scorpion bite management, organophosphorus poisoning is dealt in greater detail in clinical books. Forensic medicine and toxicology, we have forensic examination of injuries and wounds. This is vast. Like they can ask you anything. They asked countercope injury of the head. What is head injury? Okay, they're asking hanging and strangulation from asphyxia. Okay, mechanical injuries, they can ask you laceration, they can ask you this thing, but not many questions are asked so far from mechanical injuries, but it's a wider aspect. So whenever you're writing answer for forensic medicine, this is a dictum. Remember, you have to mention IPC or CRPC sections. You have to give medical legal importance at the end. Yeah. Forensic examination of injuries and wounds, blood and seminal stain. If this year they're asking blood stain, next year they'll ask you seminal stain. This is very common question. And toxicology, there's no boundary, but you can't just be preparing each and every. Just go with the previous year question. More or less, they're repeating the same. They're not suddenly asking new question, but more importantly, in the forensic, what they're doing is they're linking it with current updates. For me, a core clinician, it is tough. But for you people who are preparing for UPSC parallelly, it should be easy. For example, date rape drugs. What is the drug menace in the younger generation of the country? What are the adverse effects of the drug addiction, drug habituation? These kind of questions. They're asking, what do you do as an administrator if there is a fire mal accident? What do you do as an administrator if there is a disaster? Because you also prepare for disaster preparedness and management in your general study paper also, right? So you should be a better person to answer those questions which are integrated into general studies. This is altogether a different integration, but this is very rare. But this is happening mainly in the forensic medicine, let me tell you. Because within the forensic medicine, in the recent past, they asked you, what is DNA profiling? What is DNA bill? Because recently in 2020, that what is MTP Act new recommendations? Again, this is the latest question. And what is the drug menace in the country? What do you do as a district administrator in a fire mal accident? So these kind of tricky general study related questions they're asking, they only carry a weightage of 10 marks. But again, as you're preparing parallelly for general studies, I think you should be a better person to answer these kind of questions. So burns, it's there in the syllabus. DNA and fingerprint study is there. They're not asking you about the normal fingerprints. Definitely, they're asking you the DNA fingerprinting. When I look at the previous year question, that's what I noticed. It's a simple topic. DNA fingerprinting is again linked to the biochemistry, the PCR. What we do, PCR, RFLP and all, we all use them for DNA fingerprinting. So half of the study is done there in the biochemistry itself. So this is what is. So we are done with the first part, paper 1, section A, section B. Let's now, with this background knowledge, let's try to finish off paper 2 very fast, because in detail paper 2 I'll be doing in a separate video wherein I'll teach you how to approach paper 2, that to clinical questions. What should be written in differential diagnosis? What should be your physical examination findings and investigation findings? And all, we'll definitely do that in a separate video, which is coming maybe in a couple of weeks, right? We'll be having a live webinar for that. So paper 2 general medicine, infectious diseases covered in micro. As I told you, these are the diseases they ask: typhoid, rabies, AIDS, dengue, kala azar, Japanese encephalitis and tuberculosis. Medicine, we have part 1, etiology, clinical features, diagnosis and management. That is IHD, pulmonary embolism, bronchial asthma, pleural effusion. Part 2 of the medicine, we have malabsorption syndrome, acid peptic disease, viral hepatitis, cirrhosis of liver. Part 3, we have glomerulonephritis, pyelonephritis, renal failure, nephrotic syndrome, renovascular hypertension. Secondary hypertension is covered in surgery. Renovascular hypertension are secondary causes of secondary hypertension. What are the surgical causes of hypertension? We have, because adrenal tumors, they cause pheocytochroma, right? Pheochromocytoma. All these things are covered in surgery. Now, complications of diabetes mellitus, pathology of diabetes mellitus, both are very important. Anti-diabetic drugs is important. Diabetes is day in and day out. It's a chronic health condition. What are all the lifestyle changes which are required is also important. In surgery, diabetic ulcer, diabetic foot, it's there in the surgery also. And now we have coagulation disorders, which is there in physiology, also in pathology. What is the CML, AML, very important pathology. And now we have hypo and hyperthyroidism. The thyroid function test was there in the biochemistry. Meningitis and sepsis. This is very important because meningococcus is there in the microbiology. TB meningitis is also there. TB meningitis, tuberculosis meningitis. Fungal, cryptococcal meningitis. It is the clinical scenarios asked in microbiology again. So meningitis and encephalitis, clinical picture, CSF finding, CSF examination, how to tap a CSF sample, what is the criteria. These are all very important. Meningitis is very important topic. What is Kernick sign, what is Brudzinski sign and all are very important. Now, we don't have radiology in the syllabus, but we only have principles of ultrasound, echogram, CT and MRI. Now, nowadays, in the last 2 years, there are 2 tricky questions have come. First thing was, what is the role of ultrasound in management of liver abscess 2020? Recently also, they're asking role of ultrasound in evaluation of pain in right upper quadrant. Pain in right upper quadrant. Now, maybe we also have another topic, that is colonoscopy and endoscopy. This is also there in the syllabus. Now, we have medical procedures, we have radiological procedures, but only 4: ultrasound, echo, CT, MRI, and also colonoscopy, endoscopy and colonoscopy. Now you have to understand what are the indications for it, because ultrasound has various indications, and nowadays radiology is not just radiology, it is intervention radiology. What kind of uses we are exploring? For example, we have functional MRI. way different, diffusion weighted MRI, more sensitive for detecting the stroke and all. So these kind of things are coming up again. But ultrasound is the master here. There's so many things happening with ultrasound. So when you're preparing, you don't need to get into such wider details. But again, when you prepare investigation part of most of the medical diseases, the same thing is just taken out and asked differently. This is not out of the boundary. Okay, the same thing. For example, when we discuss pyogenic liver abscess, when we discuss amebic liver abscess, you do understand the importance of ultrasound guided aspiration, ultrasound guided aspiration of the breast abscess, ultrasound guided aspiration of the liver abscess. So these things we do discuss there in the management part. You have to just bring them there from there and put it here in your answer. So principles, therapeutic uses are advantages, and future prospects are the things which you need to look at: ultrasound, echogram, CT, MRI, endoscopy, and colonoscopy. That's it. These are the important things. Dermatology, it's like cakewalk for you. Derma is carrying highest weightage nowadays. More questions than general medicine, let me tell you. Almost 40-45 marks they're asking from Derma. I don't know why. Examiner is so much interested in asking questions from Derma. Out of the 7 or 8 topics, 4 or 5 topics will be there in the paper. Every year, the same thing. But what difference they're bringing in here? Sorry, let me finish up the books. Harrison, Bible, Harrison, Gita, Harrison, Quran, everything. General medicine, this is what I do. Harrison. But Hutchinson manual, sometimes just to understand the differential diagnosis aspect better. Okay, and Washington's manual just to understand how to investigate the algorithmic approach. And for you, it is not easy to refer all these books and make your own notes, right? Just follow Harrison. If you don't want that much of clinical knowledge, Davidson also works for you, because Davidson is a mini Harrison, like whatever points they're given. But problem is Harrison gets updated frequently. Davidson is not updated. So you might miss on latest drugs, important updates and all. So when you're preparing for general medicine, the most important thing is you need current updates. That's why I want to tell you, you can't make use of toppers notes, which is there in 2015, 2016. I still see people buying those notes from Amazon. And I still see people buying from notes from Amazon from a famous coaching institute, which is long back. You can't win a race, or you can't win a war without proper weapons. So those outdated notes, the problem is you're not getting current updates. If your colleague, if your competitor is giving best answer, definitely you're not going to get good marks, right? So keep updated knowledge. That should be your norm. That should be your motto, right? So that is very important. Yeah, George Matthews is helpful. You can go for that. It's a crisp one. It's a crisper version. Standard version is different from crisper version. Standard versions are reference books which I use for making notes. If you ask me what kind of books I am referring, I am giving you my honest advice. But if you see any question, make sure the golden dictum here is when you're referring any standard textbook, get it the latest version. This is the problem with people who are preparing after internship or during their PG or post PG. They're still referring to that old standard textbooks, right? You don't do that mistake. Get the standard textbooks if you're preparing your own notes. Get those standard textbooks and start making notes. Updated notes. Standard in the sense recent updated, latest edition notes, not the older versions. This is very important. Yes. So what else do we have? General medicine, though looks vast. If you focus, you can definitely crack this from the general medicine aspect. And we have complications. Yes, medical imaging, dermatology is very important, and psychiatry, anxiety disorders, depressive disorders, schizophrenia, and electroconvulsive therapy. Dermatology, the books what I refer. See, most of the times for dermatology, Dermanex is there, the online resource, which is very easy to find answers for. Nina Khanna is there, dermatology textbook. Harrison itself has dermatological manifestations of very diseases. Some aspects, skin diseases is covered in Harrison, approach to a skin disease part. And we also have, for dermatology, some aspects are covered in pediatric dermatology of OP Guy. That is again written by Nina Khanna herself, okay, or himself, Nina Khanna. But what I do is, nowadays, dermatology, because it is commonly asked, it is frequently asked, there are 2 areas they're focusing more on. Instead of asking straight questions, they're asking specific questions. What is the medical management? What is the biological therapy of psoriasis? What is psoriatic arthritis? How do you manage it? Psoriatic arthritis is not given in derma books. Psoriatic arthritis is from general medicine. And also nowadays, what they're asking is, how do you manage scabies in specific age groups? What is the clinical presentation of dermatitis, allergic dermatitis in various age group. And what is the diagnostic criteria for dermatitis? And they're giving you a clinical survey. A farmer is there, sun exposure, and there is a household worker who frequently washes her hands. So these kind of questions. Bindi, leukoderma, uh, for using stickers or bindis. So these kind of clinical scenarios they are giving nowadays for dermatitis. So for these kind of questions, let me be very frank with you. I'm only finding specific answers from Fitzpatrick's dermatology. Fitzpatrick's dermatology. Almost the straight lines I'm getting there. So Fitzpatrick is the one which I use for making medical MCQs for PG point of view. So therein I'm happily finding all the answers there. So, but it's again a reference textbook. It's not easy for you to read all. I'm putting all them in the notes. But for you again, if you want to prepare on your own, Nina Khanna for dermatology works for you. Okay, some aspects from pediatric OPGI, some aspects from Harrison approach to a skin disease. Very important, right? They'll give you a papillosquamous lesion has come. Your diagnosis is scabies, but you have to give differential diagnosis. For that, you have to know the differential diagnosis of a papillosquamous lesion, which is not usually covered in substandard books. You have to refer a standard book for that, right? So these are the books which I refer. Dermatology is a golden egg. Dermatology, 40 marks are coming from dermatology. Day in and day out, they're asking questions from this. You have to be thorough from A to Z from dermatology. Psychiatry, again, I use actually PG books I use for the psychiatry, because in Harrison they deal more with the counseling, not even counseling part. They deal more with the biology of these diseases, why this disease is happening, what is the pathogenesis and all. They're dealing more in that lines. So I'm not finding good answers for psychiatry in the Harrison again. Psychiatry, PG, any PG material will work for you, because there are only 4 topics: anxiety, depression, schizophrenia, electroconvulsive therapy. But what you need to do is, when you're preparing for psychiatry, focus on the psychological aspects of the treatment. They're not asking you medical, there are non-medical therapy or medical therapy or even surgical therapy for psychiatry, because we also do some surgical lobectomies and all after electroconvulsive therapy. And when you're preparing psychiatry, always focus on the ICD-10 or DSM-5 guidelines for diagnosis, because even if they ask you clinical presentation of a disease, you should mention the diagnostic criteria. Very important. Diagnostic criteria of mania, diagnostic criteria of depression, diagnostic criteria of anxiety disorders, panic or obsessive compulsive disorder, diagnostic criteria of schizophrenia. That's it. Only 5 diagnostic criteria. Make a list of them, just by heart them. Even if you remember 4 or 5, it's okay, because diagnosis is clinical. If they ask you manage, the diagnosis is clinical. You can't do any investigation for psychiatry point of view. And finally, paper 2, section A, pediatrics is no more pediatrics. Pediatrics is now social pediatrics. Pediatrics is completely based on the IMNCI management guidelines. Pediatrics is full of PSM kind of questions. What is antenatal pediatrics? What is social pediatrics? And pediatrics, there are dictum topics. A patient, a baby presented with diarrhea, baby presented with respiratory distress, baby presented with cyanosis, baby presented with jaundice, baby presented with lower weight for age, that is protein energy malnutrition. That's it. These are the 5 areas they ask questions. But when you write answer for these 5 areas, you have to include national health programs to them from PSM. You have to include IMNCI guidelines from PSM. Very important. And now IMNCI is functional IMNCI. If you're following old textbooks of OPGI, please, there's a lot changed in IMNCI. You have to refer to the latest literature or latest edition of the OPGI. This is very important. And all the IMNCI guidelines are updated in our new notes. Okay, this is very important. And also, first thing is OPGI is gold standard. Some aspects from PSM, because in the PSM syllabus we also have diseases of newborn and also maternal diseases, right? MCH, maternal and child healthcare in NRHM. So in that aspect, you have to know all the national health programs for babies or the pediatric patients. One more important thing is the other book which you need to refer for pediatrics, which I refer for making answers, is nowadays in the management of jaundice, in the management of respiratory distress, in the management of pneumonia, in the management of cyanotic heart disease, they're asking in detail, in depth. So where I'm not finding, see, answers, management answers are pretty basic in OPGI, but AIMS, neonatology protocols, they release guides. All India Institute of Medical Science, Delhi. Neonatology is the best there. So they release a lot of management algorithms or protocols. So those are copied into my notes. So these protocols will definitely help you better manage a neonatal jaundice, better manage a respiratory distress syndrome. What are the newer therapies which are available? They're better covered in AIMS neonatal management protocols. You can type in the internet also, you'll find a lot of literature, but read only which is very important for you here. So pediatrics OP guide, AIMS neonatal management guidelines, and also the PSM part of MCH care. Okay, these are more than important. And very importantly, when you answer a pediatric question, answer in lines of very important, answer in lines of IMNCA guidelines, not like a doctor. They need preventive doctors, not curative doctors. They need preventive doctors here writing this medical science optional, not curative doctors. Make this point noted. Okay, now let's quickly jump into paper 2 section B, that is general surgery. It also includes orthopedics. Maheshwari we already did with bone tumors. What is the other two topics? Fractures of spine and also Cooley's fracture, which was asked in 2021. Now, clinical features, causes, diagnosis, and principles of management of cleft lip palate, laryngeal tumor, oral. See, when I started preparing notes in 2019, actually the nightmare is general surgery, because among all the subjects, the huge syllabus is from general surgery. Huge syllabus is pretty huge, but questions are straightforward. That is the beauty of general surgery. So even during my final year or during my internship, if I want to choose general surgery or general medicine, this is what my seniors told. In general medicine, kind of diagnosis is tough. Understanding a disease, what is clinical manifestation, how to differential diagnose, what is your provisional diagnosis, how do you investigate, how do you manage, how do you investigate stuff? Management is easy. If you know the diagnosis, you can just write a drug. But general surgery, diagnosis is easy. You know the condition. What is choledochal cyst? How do you manage it? What is renal stone? How do you manage it? Diagnosis is easy. Understanding condition is easy. Etiopathogenesis is easy. But tough is surgery. But they'll not ask you surgery here. Very important. Never ever mention steps of surgery in any of the surgical branch questions, either in general surgery or OBG. You have to mention what you need to mention. You have to mention the principles of management, the principles of surgery. The clearly given clinical features, causes, diagnosis, and principles of management is asked here. Principles of management, not the surgical process or surgical procedure. Never ever by heart those things. It's not for you. It's for postgraduate students. Now, these are all the diseases which we have. I'm not reading them, but again, as I told you, endoscopy and laparoscopy are there in the syllabus. Fracture of spine, Cooley's and bone tumors are there. Carcinoma of the head of the pancreas, peritonitis, liver abscess, everything, surgical infections, GI tract and all. More importantly, carcinoma of the breast, peripheral arterial disease, varicose veins. What books I refer is, I used to read Manipal during my UG, because I couldn't finish Bailey and Love. But again, when I'm framing answer for this, questions are straight away from Bailey and Love. Straight lines from the ask. Bailey and Love, 27th edition is the gold standard for general surgery. This is what I believe, because I'm finding a lot of answers from that. And second important thing is, in Bailey and Love, evaluation is not so easy. For example, approach to varicose veins, you have to perform a lot of tests, right? The clinical tests. And approach to hernia, also inguinal hernia, you have to perform a lot of clinical examination or clinical maneuvers. Perthes test is there, etc. Tourniquet test is there, leg raising test. These kind of things you cannot answer from Bailey and Love. Definitely for varicose veins, for gangrene, for breast examination, breast lump examination, the venous examination of the lower limb, and abdominal examination, if there is any abdominal swelling or abdominal tumor, you have to refer DAS for that. DAS is the book which I refer to give you that evaluation points for it. Okay. Apart from that, rest all the things you will find it in Bailey and Love, except some clinical aspects like evaluation point, you will find it in DAS. This is what I use. Now, obstetrics and gynecology, including family planning. Syllabus is vast again in OBG, and questions are again clinical, but social obstetrics. More and more questions from MCH care, maternal morbidity, antenatal care. What are the maternal national health programs to safeguard pregnancy and lactation? What to do in lactation? Dietary management of the pregnancy. Hormonal. So these kind of questions are asked here. More and more social. Now it is becoming more and more social, and more questions from family planning. So from obstetrics, I refer Datta and Mudaliar Menon, both the books. Sometimes Mudaliar Menon give you crisp noting. Datta is more elaborative. And these days, I'm finding more answers from Williams Obstetrics again, but I don't want you to go for the standard textbook. But Williams Obstetrics, straight lines they're asking. In the last 2020-21 paper, I just observed it. Rising cesarean section rates was clearly given in Williams Obstetrics, the same things and all. And Williams Obstetrics is a standard textbook because they give a lot of evidence-based medicine there, evidence-based surgeries. So they'll give you evidence what to do and what not to do. And they also follow an algorithmic approach. Maybe if you have an updated editions of Mudaliar, Menon and Datta, it will definitely work. But Williams Obstetrics is the book which I refer for preparing notes again. And for gynecology, only one book, Dictum, Shaw's Gynecology. But for family planning of gynecology, content is there in Shaw, content is there in Mudaliar, Menon, content is also there in PSM. That is, I find more interesting contraceptive knowledge from the Park textbook instead of Shaw's. So it's only for family planning, you can better refer Park latest edition, because it is clearly given along with the national health programs which are happening on a day-to-day basis. So that's it. This is what is obstetrics and gynecology, the books you need to refer, and this is the syllabus: diagnosis of pregnancy, labor management, complications of the third stage of the liver, PPH, how do you manage, and anemia, preeclampsia, all these are common conditions. Gynecology, again, CS cervix, leukorrhea, pelvic pain. Infertility is nowadays, right, in the modern era, people are getting married so late because of the stress, because of the dietary habits. PCOD is on the rise. Late marriages, PCOD, stress and all are leading to the infertility, male and female infertility, and infertility clinics are blossoming. You might need to understand, or you might need to understand the laws which are framed for surrogacy, recent act, and you also need to understand what is MTP Act and all. So in that aspect, infertility, abortions, you have to focus. Abortion and infertility. Abortion from OBG, infertility is very important. And abnormal menstrual bleeding. It can be dysfunctional DUB, Pomcoin classification, it can be menorrhagia, it can be postmenopausal bleeding. All these abnormal hemorrhages you have to make a note of. Uterine prolapse and fibroid uterus are very important topics even during our MBBS theory prof exams, right? So you also need to focus on that. You have to learn the latest surgeries, what are coming and how they are getting managed. Okay, this is, and when to do surgery, when to do medical management, what are the drugs which are used medically, generations of OC pills and all. You have to be focusing on that. So obstetrics, gynecology, family planning, these are the things you need to be focusing on. The books, as I already told you. Finally, the last thing, but not the least, PSM. I think, as I told you, why PSM is last, because PSM is last to me, but first to you, because you are an UPSC aspirant. You are a preventive, you are a civil servant. Prevention is better than the cure. This is the best norm you should follow throughout your life. So community medicine is like that. And the one and only book is Park. But again, Park, we have 26th edition, but there's so many new stuffs have come up which are there in the platforms. Azadi ki Amrut Mahotsav, they're just confusing us. They're coming to portion 2.0, which is not there in the book. COVID has come up. There's so many epidemiological determinants which are not there in the book. And again, non-infectious diseases are blossoming, coronary vascular disease. There's so much research is going on there. So this new content is getting added up. And National Vector-Borne Disease Control Program, tuberculosis, so many things are coming up with so many researchers going on. So in that way, there's some online stuff which I usually refer to prepare my own notes. But again, for you, Park is more than enough, because direct questions, direct lines from Park will come, except for few misnomers. Again, there was some national committee and so on, so they have met, what is their objectives and all these kind of general questions. This only comes with reading paper. I think if you don't read Hindu paper on a daily basis, I think you're not ready for this exam, and I think you're a better person to answer those kind of questions than a curative doctor like me. So just focus on that. One good news for you is all the strategic plans for all the national vector-borne disease control programs and all the national health programs are 2017 to 2022. If you give your exam this year, next year, you will not be asked new questions. But new strategic plans are coming up from 2023. Maybe you're not so lucky if you're giving your exam in 24, because new strategic plans will come up. But NDTB strategy, HIV strategies and all, sustainable development goals and all, they are framed for 2030. So whenever you're writing an answer in PSM, always link them to sustainable development goals. That is very important. So these are all the things. Epidemiology, measurements, that is incidence and prevalence. Screening is not there in the syllabus. Nutritional programs, iodine deficiency program was asked recently. Nutrition is very important topic. Poshan Abhiyan, Poshan 2.4 and all, you have to focus on that. And health information system collection, uses of all this data analysis and all is very important. And National Vector-Borne Disease Control Program, malaria, Kala-Azar, filaria, and National RNTCP, which is now NTEP, and National AIDS Control Program, NACO and all. And dengue, which is again NVDC, you have to focus on that. And this aspect, critical appraise of healthcare delivery system in objectives. So NRHM is there, not NHM or NUHM in the syllabus. They clearly are asking questions from National Rural Health Mission, but you should be aware of all the national health programs which are recently launched. Like we have Lakshya, we have Suman scheme, National Parivar Vikas is there. The most latest one, just prepare and go to the exam, because they might ask one or two. For example, JSSK was asked last year, even before that. Okay. And hospital waste management, biomedical waste management, latest guidelines have come, amendments have happened. If you're following the old guides, just go and check the latest. Most are more or less similar, but a little change in way do you dispose of, little change in the waste disposable system, new methods have come up, amendments and all guidelines. And also COVID, how do you manage COVID waste, biomedical waste management of COVID used things, because COVID has changed a lot of things. I think you have to be focusing on that aspect. Industrial waste, though in the syllabus they haven't asked any questions, so don't worry about that. I think this will conclude the major part, that is understanding the syllabus.